when we open up our medicine cabinet, think, okay, maybe I need to get rid of some of that stuff that I got prescribed 10 years ago. For sure, do that. But we're going to talk about replacing some of the elements you have in your medicine cabinet with natural alternatives. So Bryce Wylde is here to help us out with that. It's a great topic. A really good topic.
Thank you.
Because I think that, you know, a lot of people are becoming more aware of how much medicine they're putting in their body. And, you know, your point is don't get rid of it all.
No.
But maybe look for ways to go natural when it makes sense.
And I think we all intuitively know that we may be abusing or overusing a particular over-the-counter medicine. And I like to consider this. We always refer to these things as alternative. My world is alternative.
Right.
I like to think of them as first-line therapy. So try these first. If they don't work, then maybe switch over to the over-the-counter or talk to your doctor. But by the way, caveat, before talking about any of this stuff, always speak to your pharmacist and doctor before changing up any of your medical routine or any of your medicine you might be taking over-the-counter or prescription. Right?
Okay.
But
I like your line of thinking,
tips.
though. Maybe try the natural first.
Right.
And then go.
And then go. It's first-line therapy. Correct.
Yeah.
Right? So a lot of switch outs to talk about today. The #1 reason you might visit your family doctor, pain, in particular back pain and headaches. So we're always reaching to the acetaminophen and the ibuprofens of the world. And so here's the switch out for that, folks. So this is the acetamin and ibuprofen. Consider, and especially for headaches and muscle aches and pains, magnesium.
Oh,
Magnesium.
really?
Magnesium, and most of us in North America are really low in this particular element. It's no longer found as much as it used to be in the soil.
Okay.
Right? So we're getting depleted systems for magnesium. But here's the trick. Not just any old magnesium. Make sure on the label it ends in ate. ATE. So citrate, bisglycinate, threonate, ATE. Look for magnesiums that end with ate. They'll work.
All right.
And also reach for the Epsom salts. Put this in your bath.
Right.
This is magnesium salts. Literally will absorb into your system and thereby reducing that pain.
There is a reason why your grandma has been telling you to do that for generations.
Absolutely.
Because it works.
Absolutely.
So sometimes you just got to listen to the old school and try out those things. Magnesium's an interesting one because I've heard a lot of things drain your magnesium every day in life.
That's right.
So if you're not building it back up again,
right,
you're not having that immunity to pain.
Hence the deficiency I was referring to. Absolutely. And you know, here's another consideration. There's a lot of kind of stinky creams out there on the market, and they may work and they may do a good job. And great, use them if you don't mind smelling. But Arnica, Arnica is a nice switch out. Arnica gel, that doesn't smell. And it actually works for bruises, bumps, strains, and pains, right? So yeah, if you're heading to the lake house this summer and you know you want to bring this in the first aid kit, I know we'll be talking about that later in the show. Arnica is a great switch out. And then lastly, in terms of pain, just remember to keep an ice pack with you. I mean, ice is a formidable natural healer to reduce inflammation. So
I love that. Okay, so we've dealt with aches and pains. Let's talk about insomnia.
Right.
When you are dealing with insomnia, like life becomes unbearable.
Oh my gosh.
So what are we reaching for usually for insomnia?
A lot of people are actually not dealing with it, so talk to your doctor. You may need a referral to a sleep clinic. Maybe it's an obstructive sleep issue such as apnea. Okay, that's a bad thing to deal with. Energy gets zapped. You wake up feeling groggy, you can't focus and all that stuff. A lot of folks are using anti-nauseants, okay? So anti-nauseant. So the switch out for the anti-nauseant would be theanine. All right?
Theanine.
So theanine is an incredible, it's an amino acid. It's a really wonderful amino acid to calm the nervous system. By the way, studies show, really good clinical studies show improvement in attention and focus, but at night an improvement in sleep, in particular with those people with ADHD and children as well. Very, very safe. But here's the tip. Look, as I mentioned with magnesium for 8, look for theanine, something called suntheanine. That's the only theanine studied in human clinical trials shown to actually improve sleep.
Suntheanine.
Suntheanine. Now, if you're a shift worker, all right, you want to reach for melatonin. And there's a lot of different types of melatonin on the market. Some are slow release, some are fast release. You want to talk to your doctor or healthcare provider about which one's right for you. But melatonin can also be a great switch out.
Do you have to be specific about when you are taking that as a shift worker? Because you kind of have to time that out.
I hear this all the time when I do a lot of traveling. So waiting in airports, I hear guys talking about, I'm going to take my melatonin to avoid jet lag. No, you take it about 3 milligrams per 50 pounds of body weight, 1 hour before intended sleep time. Now, it's a lot to remember, but if you're in that new market, you push yourself until 1 hour before you intend to go to sleep, then you take your melatonin in that new space, right? And then you do the same thing, about 3 or 4 days does the trick to readjust, and then when you get back home, you do the same thing again. But it's not a jet lag per se. You don't take it before getting on the plane to reduce jet lag.
It's not going to work.
Not going to work. No.
Okay, let's talk about nausea.
Nausea. So, the switch out, there's a lot of things for nausea on the market, but ultimately the pink stuff can be switched out. The good old pink stuff, that works, but it can be switched out for ginger.
Yes,
right?
we all know
acid
ginger.
reflux. So this is gingerols, the active constituent, anti-nauseant, anti-inflammatory, just a wonderful sedative. You can take this and literally just grate it into your cup, boiling cup of water that will take the gingerols and make them more potent.
Okay.
Literally just grate that into your cup and then drink that. If you get travel. Yeah, it's delicious. I mean, come on, remember the smell.
You know what? I'm not into
like
ginger.
Really?
No. And when
I
was pregnant, well, both times, I was pretty nauseous the first trimester, and everybody was like, ginger, ginger, ginger. I was like, you know what?
You're done?
Can you give me another solution?
This would be it, right? So
what about ginger ale? Is this a ridiculous thing to throw out there?
No,
is it just because of the sugar?
Absolutely. No, there's way too much sugar.
It
is made with ginger. Yeah, well, hey, listen, once in a while, right?
Right.
But ginger tablets would be right for you then. You don't have to go to fresh ginger. You can actually get the capsules on the market.
Okay, so that's going to work. So take it, and obviously you've got to read the instructions as to how much you're taking.
Absolutely.
Okay. Let's talk about allergies, and I feel like it's a bad season this year.
Well, actually, no. If you look at the database, it's one of the easier years. Last year was one of the hardest years for allergy sufferers seasonal for the last 4 years prior. So actually, allergy sufferers are getting a bit of a break this year. Yeah, the pollinators, but the switch out.
My friends are just complainers. Never mind.
Every year, allergy sufferers don't remember the last year. It's like when you get the flu, right? You don't remember the last flu you get. So this is the worst flu I've ever had in my life.
Right.
We'd forget purposely, otherwise we'd be in trauma all the time.
Yeah.
So this is not per se a switch out. Okay, this is an addition. So what I'd like to do is I'd like to add quercetin, okay, to an already pre-existing antihistamine routine. Now, quercetin's a bioflavonoid. So really quick, here's how an allergy works. Okay. An allergy works by a mast cell, which is part of the immune system, getting aggravated at something, and it's a misconceived, mistake by the immune system. The mast cell blows up and releases histamine. So an antihistamine deals with that histamine, blocks it, and throws it away. But guess what? Quercetin manages that cell so it doesn't blow up in the first place. So this 1-2 punch will work really well for allergy sufferers.
So you're adding to what you're already taking. I love that. Okay, what about constipation? Gut issues are one reason why you might be going to your cabinet.
Let's switch out the Senna and Senna-Cot. And by the way, it's a natural remedy. Okay. And let's look for soluble fiber. Okay, so soluble fiber. So what you want to look for is guar bean extract. In this case, it's called sun fiber, but soluble fiber will disappear in water.
Yes.
So versus that gloopy, gloppy stuff, right? So this stuff, so that's a regulating fiber, and it won't give you the symptoms that you're actually looking to avoid, that gas and bloating and constipation. It will actually regulate you. Okay. So switching out Senna, this is an irritant, that's a regulator.
Does this take longer to fix the problem?
It does take a little bit longer. You're right about that. A couple of weeks versus overnight. Okay. But that's the point, regulating yourself. And there's a whole bunch of varieties of sun fiber that you can find on the market.
UTIs are a big one.
Another non-switch out here. Cranberry extract will work, not the juice. Yeah. Cranberry juice will not work. It'll contribute to the problem. There's too much sugar in there typically. And people that actually find the right juice, the pure extract, it is so bitter. That's the point that they won't use. They won't be compliant with it. Okay. So here's a switch out. Any old cranberry for something just as I mentioned with magnesium, what you want to look at is for an ingredient called cran naturel, which, by the way, is produced in Quebec, in Canada. All right. Okay. So Quebec, and they manufacture this so that it looks like that. So here's the visual taste, folks. If you're at home and you have cranberry products, empty them out and do this with us, and we'll do a taste test really quick. All right. The lighter the color is, there's no cranberry in there.
That's less effective.
Very little. It's very ineffective. This dark stuff. So taste this. Taste that really light stuff. Tell us what you think. It should taste like tart, bitter cranberry. What is that?
It's bitter.
It's a little bit better? Okay.
Let me try this one. So this one's super concentrated.
You want to look for dark color, and you want to be, yeah, like you bit into a tart cranberry.
That's a cranberry.
Yeah, that's what you want to look for. So for
that's
UTIs, that'll
work.
But use the dark, bitter stuff. Otherwise, it's not going to work for you.
Use the right stuff. Really good information.